Okay. Okay. Today we welcome at WCCH Dr. Sheryl M. Green, PhD. Dr. Green is a clinical and health psychologist within the Women's Health Concerns Clinic and Sleep Medicine Clinic at St. Joe's Healthcare, Hamilton, Ontario. She's also an assistant professor in the Department of Psychiatry and Behavioral Neurosciences at McMaster University and co-director of clinical training for the PhD program in clinical psychology, Department of Psychology. Dr. Green's clinical interests include cognitive behavioral interventions for depression, anxiety, and health-related difficulties. Her research interest includes developing cognitive behavioral treatment protocols designed to meet the unique needs of specialized populations, for example, prenatal menopause, and is the author of 2 books on women's health, including cognitive behavioral therapy for anxiety and depression during pregnancy and beyond, and the cognitive workbook for menopausal symptoms. I welcome you once again, Dr. Green. You can begin your presentation. Lee will give you access to the screen so that you can control the flow of your presentation slides. Thanks again.
Well, thank you so much, Louise, for that lovely introduction. It's wonderful to be here with you all today. I have a few goals for this presentation, and I'm just going to share my screen so that you can see the slides that I have prepared. And start. Did everybody see that?
Yes, Dr. Green.
Thank you, Louise. So yeah, a few goals that I have for this this presentation here today is includes one of which I'm hoping to share just with you just how prevalent mental health difficulties are along the reproductive timeline in women, including pregnancy and the postpartum. And you'll often hear me refer to pregnancy postpartum as the perinatal period. So just perinatal period means a combination of both pregnancy and postpartum, as well as the menopausal transition. So another goal here I have is to highlight the context in which women experience mental health difficulties during these times so that it will shed some light on why mental health difficulties are so common. And then finally, what some of the treatment options are for mental health difficulties during these times, both medication and non-medication options. So up until puberty, the rate of depression in girls and boys are equal. But following puberty, the rate of depression is 2 times greater in girls than boys. And folks, this is observed worldwide. It's not just in North America or Australia. This rate of depression in females versus males is a 2 to 1, right? Double all over the world. And we understand that hormones play a big role in this. If we look at a woman's typical 30-day menstrual cycle, we can see that the fluctuations in hormones, such as estrogen and progesterone, on a monthly basis here. And why is this important? Well, we know that hormones influence an area of the brain that's responsible for emotion regulation, called the limbic system. And the fluctuations can cause emotion dysregulation, and commonly depression and anxiety. Most women experience what we call PMS, right? Everybody's heard of PMS, premenstrual syndrome. This is a type of occurrence that involves a number of different physical and mental health difficulties, so such as low mood, anxiety, bloating, breast tenderness, to name a few. And even some women experience a significant version of this and are diagnosed with what's called premenstrual dysphoric disorder. And the rate of depression and anxiety disorders increase dramatically during pregnancy and the postpartum. With depression, we see rates as high as 7 to 12% in pregnancy and 13 to 19% in the postpartum, or nearly 1 in 5. And this is a very striking number here, considering the annual prevalence of depression in women in Canada is just under 6%. So consider during pregnancy and postpartum, we're about 1 in 5 women. And during, or outside of the pregnancy postpartum period, it's just under 6%, or maybe 1 in 20. So a significant increase in the prevalence. And similarly, up to about 20% of women, or 1 in 5, meet diagnostic criteria for an anxiety disorder. So 13 to 30%, 31% in pregnancy, and about 11 to 17% in the postpartum. Anxiety disorder called general anxiety disorder is the most common during the perinatal period. And that prevalence is significantly higher in pregnancy postpartum compared to the general population. We're looking at 1 to 3% in the general population versus up to 10-11% in pregnancy postpartum. So this is why we refer to the perinatal period as a window of vulnerability for experiencing mental health difficulties. All right, so why is there such an increase in mental health difficulties during this time? Similar to PMS and PMDD, so premenstrual syndrome and premenstrual dysphoric disorder, we know that hormones play a significant role. As you can see from this graph, there's a steady increase in the reproductive hormones, estrogen, progesterone, during pregnancy, and a significant drop immediately after delivery. And we know that reductions in estrogen are associated with low mood, and that this significant drop in estrogen right after childbirth results in what most women experience, at least a little bit of something called the baby blues, right? So a few days of feeling weepy or low mood, but up to 20% of women are going to be experiencing a clinical episode of depression, right? So a significant depressive experience that's a lot more than just the baby blues.
Sheryl, can I just note that the slides aren't progressing? We're not able to see. Are you able to change the slides?
So right now I have a slide that's called Meet Jennifer. Are you able to see or no?
I have just the regular, the first one showing on the screen.
Oh, the very first slide.
Just the very first slide showing.
Okay.
If you're able to advance them.
Let's stop share.
Okay. Yeah, I just saw the note that a few people were saying the same thing.
Okay. I'll try this again in maybe a different type of format. Can everybody see this?
Yes.
Okay.
That's perfect.
Maybe what I'll do is leave it in this mode.
Okay, perfect. Thank you.
Okay. All right. Very good. All right. So I was, I guess, over here. So yeah, changes in hormones are not the only factor that plays a role in the increase in depression and anxiety that we see during the perinatal period. And to demonstrate, I would like to just walk through this little vignette called Meet Jennifer. So Jennifer is a 28-year-old woman who lives with her husband in Hamilton and in a 2-bedroom starter home. She loves her full-time work as an elementary school teacher. Her parents and her in-laws live about an hour away in Toronto. She has several close friends whom she sees to go shopping with or out for dinner. And although some of her friends are also married, none have children. Jennifer is very active, playing soccer or jogging about once or twice a week. And she likes to go with her husband every other week or so on a date night. And they enjoy trips to Toronto on long weekends. So Jennifer is now 3 months pregnant, right? So what I'd like to just highlight here are all the different changes that are going to take place in Jennifer's life, right? It's not one or two changes that will take place. It's changes in every aspect of a woman's life here, right? And we know that changes in life, even positive changes like, planning for a wedding or moving to a new city, starting a dream job, right? Positive changes, they're even when they are positive, it brings about a lot of uncertainty, right? And with uncertainty, that can be very stressful. It can increase anxiety. And here, just, when we look at a couple of changes, like I mentioned in life, compared to changes in every area of one's life, that can produce, right, a lot of stress, anxiety, and impact on mood in a negative way. So for instance, there's Jennifer is going to be experiencing a lot of physical changes with this pregnancy, right? And into the postpartum, there'll be potentially nausea, vomiting, all the fun stuff that go along with pregnancy, some heartburn, shortness of breath, fatigue, right? There's pain during and following childbirth. The relationships that she has with important people in her life are going to change, including her spouse, right? So the change in the relationship with husband will go from primarily romantic to one of maybe a little bit more working partnership, right? There'll be fewer social events, at least temporarily in her life. She won't be able to engage in the same type of physical activities, again, at least temporarily. And financially, right? That's children are not inexpensive to have. There's a great expense to having children, everything from diapers to buying strollers and cribs and car seats and so on. New priorities in a woman's life, right? New responsibilities, new roles when she becomes a mother. That's going to impact how she feels, and also the steep learning curve with how to care for the health and well-being of a baby. So all of these things can contribute, right, to how one feels in a positive and a not so positive way, right? So it's not just the hormonal changes that take place; those are significant. But I like to just stress and have people recognize the context here too, of which or what happens in life during pregnancy and the postpartum. So impact of depression and anxiety. Why do we care about this so much? Why is it worthwhile to have a presentation on? There are significant negative impacts on both mothers and their offspring, their infant. So for mothers, they're experiencing more stress. There's less prenatal care that takes place when women are struggling with mental health. And there's more frequent negative mother-infant interactions, so disengagement, maternal withdrawal. Can also be more frequent obstetric complications, medical problems, more emergency room visits. And then for the infants and children of mothers suffering from mental health difficulties at this time, there can be difficulties with low birth weight or low fetal growth, higher incidence of excessive crying in the infant, sleep problems and temperamental difficulties following birth. It can affect a child's development cognitively, right? And there can be some strong emotion reactivity in infants. Women can feel very not so competent as a parent, and satisfaction within the marriage can also suffer, as well as lower social support. So a lot of reason to care and be mindful of how frequent these mental health difficulties occur and how important it is for a woman to get treatment. In addition to the biological influences, the hormonal influences here, as well as the life context, that contributes to how frequent mental health difficulties are in pregnancy and postpartum. There's a number of risk factors here too, that if a woman is experiencing, it puts her of course at greater risk of developing these mental health difficulties. So when there's a history of depression prior to pregnancy, right? If a woman has had depression in a previous pregnancy or even before that, really important to make sure that that's aware, that her healthcare team is aware. Low social support, marital conflict is also a risk factor. Unstable or low income, being single or being younger when pregnant, postpartum, are also risk factors. Obstetric complications or an unwanted pregnancy. History of abuse a woman can have in her lifetime. Lower education, and if one is living with extended family members or having multiple children. And finally, sleep difficulties. Oh. Okay. So how do we help women during pregnancy and the postpartum with mental health difficulties? We look to the Canadian psychiatric guidelines that do recommend psychological treatment, such as cognitive behavioral therapy or interpersonal therapy for levels of symptoms that are in the mild to moderate range, right? And there are medications in the form of SSRIs, selective serotonin reuptake inhibitors, that are considered effective and relatively safe. But shockingly, only about 50% of women with mental health difficulties receive treatment. And folks, only 10 to 15% of those individuals are receiving effective treatment. So whether that's a psychological treatment like CBT for mild to moderate symptoms, or for maybe a little bit more severe symptoms and medication, only 50% of women are receiving treatment. And this is partly due to, I guess, the knowledge of available resources, or not having very many resources to refer to. So myself, as Louise has mentioned, I'm from the Women's Health Concerns Clinic at St. Joe's. And this is it's a very special clinic, and it's a specialty clinic where we receive pregnant and postpartum women with mental health difficulties. To offer assessment and treatment. But we are very such a specialized clinic and there's not too many of our kind around, right? We have there's other clinics in Toronto, but you know, the patients that I have the privilege of serving day to day, you know, some will be coming from Niagara-on-the-Lake, some will be coming from Guelph, some will, you know, be coming from Burlington. So it's I can appreciate that this is one of maybe the obstacles of receiving treatment and receiving effective treatment, not having a lot of available resources. So another barrier for access to treatment is just the hesitation that women might have to communicate that they have mood or anxiety symptoms during pregnancy and postpartum, because there's a stigma associated with it, or believe that they're going to be perceived in a negative way by others, right? So the final thing I want to mention here about anxiety and depression during pregnancy postpartum with treatment considerations is many women cannot or choose not to take medications during this time. And that's something that we work with women every day as they come in for assessments in our clinic. For those who cannot take medications or those who do not want to take medications, as I mentioned, it's effective and relatively safe. There's no 100% guarantees with the impact of depression, of medication on pregnancy and into the postpartum with breastfeeding. So some women don't want to take a chance. So there absolutely has to be an effective alternative, effective non-pharmacological alternative that are offered to women. And we're very proud to be able to offer that at St. Joe's in the Women's Health Concerns Clinic. So I'm going to shift gears to talk about the other window of vulnerability for mental health difficulties that women experience. So namely the menopausal transition. And here now we're at the other end of the reproductive timeline. So what is menopause? Menopausal transition, also known as perimenopause, is that transition from reproductive to non-reproductive years. And both it's associated with this gradual decline in reproductive hormones. So namely estrogen, progesterone, those two hormones that I've been mentioning over the course of this presentation. Menopause is a time in a woman's reproductive timeline that represents the end of childbearing years. So a woman has, so to speak, achieved menopause when she's experienced no menstrual cycle or the absence of a menstrual cycle for 12 consecutive months, right? So up until then, she's considered to be in that perimenopausal the menopausal transition or the perimenopausal years. And that lasts around 4 or 5 years on average. And the average Canadian woman reaches menopause at about 51, 52 years of age, right? So there are a number of symptoms that women experience over the course of the menopausal transition and once they achieve menopause. Both mental health related symptoms and physical symptoms. Hallmark symptom, of course, everybody knows it here, the vasomotor symptom. That's just a fancy term for saying hot flashes and night sweats, right? Considered the hallmark of menopausal symptoms just because of how frequently they're experienced by women. So about 80% of women at some point in the perimenopausal menopausal transition, they'll experience either hot flash or night sweat. And these can be each woman is different, just like each pregnancy is different and unique. Women can experience these symptoms and not have a lot of difficulty with it, whereas they can be completely distressing, interfering, and so intense for other women, right? Another very common experience, or I call these the top 5 symptoms of menopause, just because they are the most prevalent. So depression, the transition to menopause here is associated with an increased risk for an onset of a depressive episode. So if a woman has not experienced any depressive episodes before in her life, she's up to 4 times more likely at this time to experience a major depressive episode. So these mood symptoms, right, are a very significant and common symptom during menopause. Anxiety, depression, I'll go into anxiety. So depression and now anxiety, about half of women going through the menopausal transition are experience anxiety reported as problematic. And then there's sleep difficulties. About 60% of women experience difficulties with sleep. And this can be just, alone, like just difficulties with sleep outside of night sweats, but sometimes the night sweats kind of play a role in a negative way with sleep difficulties. A woman can wake up in the middle of the night, experience a night sweat. It could be very disruptive, having to change pajamas, get back into bed, and try to fall asleep again. So those two can go hand in hand at times. And then finally, the last most common symptom during menopause is what we call urogenital complaints and sexual concerns. So the urogenital complaints, a couple of examples of that is things like vaginal dryness, bladder incontinence, and sexual concerns, that low libido, right? That low desire or interest in sex anymore. So a lot of symptoms that a woman can experience here. And so why is this? Why are all of these things happening to women during pregnancy, during postpartum, during the menopausal transition? Well, we know that hormones are partly responsible for contributing to these symptoms, right? We know that estrogen plays an important role in both our psychological, or like our mental health, and our physical well-being. And it's these major changes, and more importantly, the fluctuations in estrogen levels that have an impact on things like our mood, things like our sleep, our sexual drive. So when ovarian production of estrogen, when it starts to fluctuate, and ultimately there's this depletion of estrogen because we're going from childbearing years, right? A monthly cycle, being able to potentially have a child each month here, to non-reproductive years. There's a depletion in estrogen because we're no longer ovulating, right? So experiencing that lower level of estrogen has a significant impact on many areas of our body. And this is why, we experience both mental health difficulties like mood and anxiety, as well as symptoms such as hot flashes, night sweats, sleep difficulties, and so on. And it can affect overall quality of life and functioning. So once again, I do want to highlight that, yes, hormones, there's a biological influence for all of these symptoms, but it's not just that straightforward. There's some important considerations with mental health difficulties experienced during this time related to developmental or life contexts, right? So clearly a biological influence in the form of fluctuation in hormones. But common developmental life changes here that are associated with growing older can also increase the likelihood of mental health difficulties. For instance, right, the transition from being able to physically have children to the loss of this ability. Children that a woman has, maybe growing up, becoming more independent, spending less time with family, and even moving out and away, right? That empty nest syndrome that we hear about. There may be circumstance where we're retiring early, and as a result, the daily life and lifestyle changes. It looks different, taking on new roles, such as maybe becoming a grandparent, or taking on additional family responsibilities, such as being a caregiver to aging parents. Right? That actually, on that note, it is, I've heard folks at this time refer to as like a sandwich generation, where developmentally, sandwich generation, where you're looking after children still, or providing support to children, working full time, sometimes being at the height of one's career, and there's a lot of work and time and effort associated with that, and then also looking after an aging parent, right, who needs medical assistance there. So a lot of stress can come about as a result of that. So a couple other highlight, considering the meaning and purpose of life, right, as we age, increasing financial obligations if we have children who are in college, or medical issues that are associated with aging. And then again, so as I stress, the continued demands of juggling multiple responsibilities, both at home and at work. So any change, again, even positive ones, can lead, like becoming a grandparent, can lead to stress in life and exacerbate these menopausal symptoms that I'm highlighting, especially the depression and anxiety. So just going to take a couple of minutes here in the home stretch to talk about some treatment options. So hormone therapy was widely accepted and kind of generally considered to be the gold standard of treatment in the 1980s and 90s, which to me makes a lot of sense, right? When there's when the difficulties of fluctuation of hormones and then depletion of estrogen is causing all of these psychological and physical symptoms, why not take estrogen, this hormone replacement, to get back to a stable level of these hormones, right? And that's exactly what studies have found, and people who are using hormone therapy, or also used to be called hormone replacement therapy, used to experience. So they found reductions in significant in vasomotor symptoms like hot flashes, night sweats, improvement in mood, sexual concerns, and so on, depression and anxiety as well. But there was a large study that came out that examined the long-term health benefits of hormone and risks of hormone therapy, and found that there was an increased risk for certain cancers and cardiovascular events like strokes and heart attacks. So then, towards that turn of the century, everybody just stopped. They pressed the panic button, stopped taking this medication, prescribers stopped prescribing it, and so there was folks here without this very effective treatment. But a reevaluation or reanalysis of the results or the data was conducted and found that hormone therapy is there is an increased risk for certain cancers, but only if it's used more than 10 years. So there's certain guidelines now associated with hormone therapy. It's only to be taken shorter term, and not for folks who have a history or a family history of certain cancers like breast cancer, endometrial cancer. And right now it's still considered the gold standard medication for many of these menopausal symptoms. And I'll just highlight a couple of other treatment options that people turn to that do have a bit of research behind them. Antidepressants, well, not surprisingly, are helpful in the treatment of depression and anxiety. And very interestingly, hot flashes and night sweats. So folks I've seen in my clinic who don't have any anxiety or depression, but they have significant hot flashes, night sweats, they'll be prescribed an antidepressant, and their vasomotor symptoms are significantly improved. It's quite amazing. But other alternative treatments here, so to speak, are herbal therapies like black cohost, red clover, St. John's wort. There's a little bit of research here that's showing that on average that some of these herbal remedies may be effective, but significantly less so than hormone therapy or antidepressants. And then acupuncture, there's some limited results for that type of treatment. The last thing I'm going to emphasize here is the non-pharmacological approach to treatment. And as a non-prescriber myself, I always like to highlight this as an alternative or a complementary form of treatment, cognitive behavioral therapy. There's been studies that have looked at cognitive and behavioral methods for treating hot flashes and night sweats. And of course, we know that have been very effective. There's very, very effective CBT protocols for sleep disruption, insomnia. Actually, CBT is the first line treatment for sleep disorders like insomnia. And so my team and we put together a comprehensive treatment program that targets each one of these 5 most prevalent symptoms. And conducted some research and found that this treatment, CBT for menopausal symptoms, to be very, very effective. So for folks who cannot or choose not to take medication, and for those who are taking medications, but just not receiving the type of relief that they want from the symptoms. And so this is a nice complementary form of treatment. The gains in my studies, I've seen 3 months. And so to me, that's very encouraging. Once you stop with the treatment program, you're still maintaining all these gains from the treatment program that you participated in. So just want to highlight at this point, it's recommended that each individual, if you're experiencing these types of symptoms during the menopausal transition, as well as during perinatal period, to have a chat with your doctor to see, what type of treatment recommendations are best for you. And I'm going to pass it over to Lisa here at this point.
Thank you, Dr. Green. And I appreciate if you could continue just forward the slides. I don't think I'll have that opportunity to do that, but appreciate your help with that. Before we get to our Q&A, I had thought it would be helpful for everyone just to know a little bit more about the various types of mental health services and programs that are offered at St. Joe's, because we have an array of services at St. Joe's. So next slide. St. Joe's is now the second largest provider of mental health and addiction services in all of Ontario. We serve a wide population, just over 2 million people in our community from the ages of 17 and up. So whether it's someone living with anxiety and someone that has depression or schizophrenia, bipolar, as Dr. Green mentioned, a lot of folks come to St. Joe's and are helped at St. Joe's for mental health. And due to the COVID-19 pandemic, unfortunately, we've seen such a rapid increase in the need and demand for these types of services in all age groups. So it's so very much a priority for St. Joe's and for our foundation to provide these services to our community. Next slide. And what came out of the pandemic was a need for a centralized intake service. So we have 17 different adult outpatient mental health and addiction programs at St. Joe's. And a lot of people just did not know how to navigate all of those services. And where do you get help? How do you connect with the right person? So they started a program called Connect. And it's just by calling our main line at the hospital and asking for the Connect program, or you can go online to St. Joe's Connect and you can find services available there. But it's really all about connecting the right care, the right place at the right time. So it's a great program that has come out of COVID, and it really helps people navigate getting the right type of care for their circumstance. And mainly, a lot of these services are offered virtually, which is helpful too. So people from all across the region can participate, and it's out of the comfort of their own home. Next slide. So for youth services, we have a number of programs for youth, and that is ages 17 to 25. A lot of our youth are helped through our Youth Wellness Center, which is a program some people may not be aware of. It operates not in the hospital, but it's at James Street North, and it's part of the Piggott Building. And so it's a very friendly youth-centered program that is a self-referral. So anyone that has experience with anxiety, depression, any kind of mental illness can self-refer to our Youth Wellness Center, go down to the program or go online and apply for service. And that's available to youth, like I said, 17 to 25. So we have services for BIPOC youth, which is Black, Indigenous, peoples of color, and their families. So we have a Youth Thrive program. We have our Empowerment Fund, which is for youth that have financial needs that might be related to finding education, living expenses, or even transitioning. And we also have an eating disorders program for ages 16 to 18. Next slide. And then for young adults, we've just piloted a program early 2021 for young adults with substance use and mental health. So concurrent disorders there. And so it's really a support program. It's mainly online, but it's for ages 17 to 25. And again, focuses on young adults with both substance and mental health illness. And then for women, and we've talked a lot about our Women's Health Concern program that Dr. Green just related to, but specializing in women with pregnancy, postpartum, premenstrual, menopausal related mental health issues. And things like a forum that was created and we held last December called Opening Up. And I know a lot of these forums will continue because people are appreciating the opportunity of just getting together and discussing issues that we were chatting about today, about childbirth and mental health issues that arise during the pandemic. So those services are available. And our Womenkind program is operated out of our the West Hamilton site. It's a 26-bed facility. It's a residential program and a day program for women dealing with substance use and recovery. So that's a very important program as well for women. And then seniors. So we have a very integrated seniors program out of our West Fifth Hospital. It is a seniors mental health outpatient and outreach program. So we also have an inpatient area for our seniors that struggle with complex mental health and addiction issues. So there's an in-bed area there for seniors needing that kind of special supports, but varying outpatient programs as well for seniors to do with mood disorders and cognitive impairment, chronic mental illness, such as schizophrenia or bipolar. So again, those services are available mainly at our West Fifth site. So we just wanted to give you an opportunity to know that there are a number of services offered through St. Joe's for anyone from ages 17 and over. If you have anyone that you know of that could use the help, we thought these services might be good for you to be aware of, so you can offer that help to others. So I work at the foundation office, which is just adjacent to the hospital, and we help supporters who want to give back to various areas of the hospital. But we thought you'd be particularly interested in knowing about our mental health services here. So we would take the opportunity to welcome any questions that you might have for Dr. Green at this time. I'm not sure how to organize that, but if you have a hands up icon, you could put on the screen, or just take off your microphone and ask a question.
Thanks, Lisa.
Any questions? As Dr. Green will be able to see the icon, and then she'll call on you.
Oh, Susan.
Yeah, and maybe I missed it, but do you have any stats on, for example, the generation before, like 20 years ago, I guess is a generation approximately, I don't know, but of mental health issues in younger girls, like teenage and 20-year-olds, and how much that's risen? Has it risen? Like, what percentage would that be?
Oh, it's such a good question, Susan. I don't have any stats or knowledge on that. The youngest, I guess, age that we receive at Women's Health is 18 and up. And so it's just, it's not an age group that I'm familiar with or have much experience with. My apologies.
Maybe we could just let Susan know that McMaster Children's Hospital has an array of services for children that are younger. So you know, age 1 up to probably age 17. So they're serviced through the McMaster Children's Hospital. And then when they graduate to the adult stream, they would come over to St. Joe's for care through our adult program at St. Joe's, just so you know the difference there with the two hospitals.
Oh, thank you. Like all right, so for the young children, say up to 12 or 18 or whatever, are there what percentage of our population would have mental problems? Like I would, for me, I would think it would be very little, but I have no idea of mental illness in children, and if it's prevalent at all, or if it's just non-existent, or pretty well, you know.
Yeah, I think the area of that I'm licensed is adults and geriatric population. So I'm on the other end of the spectrum, but the little that I do know about mental health difficulties and such in our youth is that it is actually quite a problem. A lot of people are experiencing significant depression, anxiety, and so on. We've in the years that I've been at St. Joe's, I'm just rounding out my 17th year here now. And I have seen the development of some of the programming that Lisa made mention of, the Youth Wellness Center, and that didn't, we didn't have that a few years ago. So to me, that just speaks to the need that there are in our community, and just the need in general with our youth. That is problematic. And I'm not too sure if Lisa, you want to add anything to that with that.
Well, and I can't speak as a medical doctor, but knowing that even our eating disorders program helps people 17, but I know through McMaster Children's Hospital, children as young as 6 are going to McMaster Children's Hospital for eating disorders.
Oh my.
So that speaks to the fact that young girls are dealing with some serious issues at young ages, right? So I don't know the statistics either, but I know our young people especially are seeing an increase in the need for mental health and addictions services.
Mm-hmm.
Thank you.
I have a question, if you don't mind. I'm wondering about when you talk about women who are experiencing mental health issues during the pregnancy and post-pregnancy, postpartum period. Is it more prevalent in women who have had mental health issues as children or young adults, or is it really something that just comes on during that period?
It's absolutely accurate. That's a risk factor, right? If you've had mental health difficulties, you struggled with that at other times in your life, you're at it's a greater likelihood that you will have some challenges during pregnancy and the postpartum. But I've also seen something that's called de novo, which is like having an episode of depression, or never having during pregnancy for the first time, never having any mental health difficulties, and all of a sudden, and anxiety, no problem, and then boom, like there is significant anxiety difficulties. I've seen both, but I would say more so it's the former, where there's people who have mental health difficulties at different times of their life, and this is like a time where it flares up again.
Mm-hmm.
Yeah.
Okay.
Great question. And I think knowing that, actually, I'll just offer a little bit more on that. Knowing that, I think folks can start to prepare in advance, right? If they know that they're a little bit more at risk for experiencing challenging mental health problems, reaching out to healthcare providers to get to proactively plan during the pregnancy, get the supports in place beforehand. Even the Women's Health Concerns Clinic, that's exactly what we do before someone even becomes pregnant, when they're trying to conceive, right? Getting consultation with our treatment team about the medications that they're on, becoming a patient beforehand. So there are things to do in advance, and I love the proactive approach. That's my favorite approach. Nip it in the bud before.
Mhm.
Oh, Ellie has written something. Can you be more prone to mental health issues if you're breastfeeding, especially extended breastfeeding? So yeah, the question is, can you be more prone to mental health issues if you're breastfeeding, especially extended breastfeeding? So I know that with breastfeeding, there's more, fluctuations in hormones and such. I know that if a person is experiencing depressive episode or anxiety, they're less likely to engage in breastfeeding or discontinue early. Breastfeeding can be it's a lovely thing, but it can be a very challenging thing, right, to engage in. And I've worked with endless women who have had just those types of struggles where, the baby won't latch, and, there's difficulties with the baby getting enough food from the mother, and that creating a lot of stress and anxiety and mental health difficulties. So, but yeah, that would be my response to that question. It's a great question. You're very welcome.
I can put my icon up, but I do have a question.
Sure.
And it involves geriatrics. So what programs are in place right now for the geriatric population who've gone through a pandemic and are extremely lonely, or don't have a strong network any longer as their friends have passed on? Are there services available in Hamilton for these seniors?
Yeah, I know that we have a seniors mental health program, and I wonder if Lisa, do you have some specific information about that programming, or not so much? Oh, you're on mute.
There we go. Yeah, there are a number of geriatric services at St. Joe's, but some of them are the ones that we've already shared already, in terms of the neurocognitive disorders, memory concerns, dementia. There's a number of small groups and groups that are available for people to learn CBT to cope with some of these issues, as well as mobility changes. We have those that have geriatric problems. Also, there's a number of services, outpatient services down at our King Street campus, I know, with just mobility and helping people, remain active and mentally sharp, that kind of thing. So yeah, there's memory type clinics, but just sort of a number of different services available. You can Google them online at geriatrics at St. Joe's. That should be able to kind of help you with a little bit more if you're looking for something specific. You can reach out and let us know.
Thank you. I deal with a lot of seniors, and one of the biggest issues that I'm running into is their loneliness, especially since the pandemic.
Yes.
And they're being shut in more or less. And that's in senior buildings that we have in our city. a lot of them feel very closed in. So it will be good to give them some information that could help them. Thank you so much.
Great. Thank you for asking. It's nice to be able to respond and say, yes, here is a service, or go here and we can take care of you there. Right? It's as the second largest mental health hospital here in Ontario, as Lisa's saying, like it's just such a it's pride and privilege to be able to work here and serve so many different age groups and mental health concerns of the people in our community.
I want to encourage Diane too, maybe to look into the Connect service, which is that intake for 17 different programs at St. Joe's. So that might be a resource for you too, to see if there's any kind of programming like that for seniors that are lonely and just need companionship.
Great idea.
Okay, thank you so much.
Welcome.
Any other questions?
It's
Ruth?
it's a bit of a question, but also an observation. I received in the mail about 2 days ago a fundraising, blurb of the return envelope and everything from the Trillium Health Network, and they're asking you to support healthcare in your neighborhood. Well, it came from Mississauga. I don't think St. Joe's is part of that network, are you?
It is different. It is a different foundation. Trillium Health is different from St. Joe's
Well, this is
Healthcare.
it. Actually, I live down in the Niagara Peninsula. My closest hospital is the West Lincoln, but I thought, like fundraising in your foundation is so important for maintaining your programs and developing new ones. And I thought, why are they sending, kind of invading your territory, so to speak?
Yeah. There's 88,000 different charities out there. So it is difficult. There's some overlap, right? But you really, people need to look at their priorities and just, decide where they want to give. But yeah, I hear you. There's a lot of overlap, sometimes confusion too, right?
Yes.
What people are fundraising for.
I find that Women's College Hospital is very prolific with their ads and requests that way too. So I think they've got a good program going there for,
Definitely do. Sure.
But I can tell you that the St. Joe's Foundation is a wonderful foundation. And I believe you and I have had a chat once before after my dad passed, and he had been a monthly donor. And of course we had to change that. But my sister and I have kept up the support in his memory ever since. And we just think the foundation does a great job. And we're so lucky to have St. Joe's in this city with all that they have to offer, not just the mental health, but, my particular thing was the hemodialysis unit. And we're just very, very lucky to have that hospital right here in the center of town.
Definitely. Thank you for saying that, Lee.
I was just going to say my husband is on dialysis, and Lee and I have spoken about the program at length, and it really is a wonderful program, and everyone takes such good care of patients. It's really great.
We're very fortunate to just revamp that whole dialysis area at the Charlton campus, and making it so much easier for people that have to spend maybe 3-4 times a week there, and maybe bring a family member with them. So to be able to refresh that space and enlarge it has meant the world to patients and their families. So it's again due to community support. So we're very grateful.
Actually, my husband goes down to Stony Creek, and we live in Dundas.
Okay, yes.
Well, the reason is that he doesn't walk well, and he can go right down to Stony Creek and park right beside the room that he's supposed to be in. And the parking is wonderful as far as cost and everything. And it's you know, it's not a bad ride down there if you get going on Main Street and
Right.
you can, you know, get through. So but he is very pleased with everyone there. They thinks they're wonderful. Yeah.
That's nice to hear.
Any further questions? No? Today's presentation was a co-presentation with the Hamilton Fempreneurs. Unfortunately, the co-founder had another meeting to attend, Susan. She's now driving to that meeting. So our next meeting, I'm sure we'll be back, and I will formally introduce you to Susan Zanbergen. It's a wonderful group of entrepreneur group here in the Hamilton area that provide support to each other. Dr. Green, we thank you very, very much for your time and the wonderful presentation you did today. Lisa, sincere thank you. St. Joseph
pleasure.
Healthcare Foundation, we thank you. Very, very informative. It was very educational and informative. Thank you so much. I learned a few things too.
Good to hear, Louise.
Great
Thanks
to
so
hear.
much for having me, and a pleasure to be here with all of you. Thank you.
Thank you.
Here,
God
thank you so
bless you.
much.
Bye.
Our meeting is 111th AGM, which didn't take place, but our presentation is now finished. So we're adjourned. Please feel free to stay, mingle, network, depending on your schedule, to socialize via Zoom.